So what we would like people to have is a documentation you had COVID. Speak to the team. In other words, it could be, you had test, PCR antigen test positive. We recognize that early in this pandemic that for many people, they didn't get a test. And it was pretty clear they had COVID, but they may not have had a test. I mean, let's face it, go back to the early days of the pandemic. We didn't have a lot of testing going on back then. And people clearly had COVID. So we certainly allow for a healthcare provider diagnosing it in the absence of a test. We prefer the test, but we recognize that didn't happen for a lot of people, or it's just not available anymore. And we recognize that. We don't want people to be compromised for that reason. So we can make accommodation. We do like a healthcare provider to have acknowledged the condition. Some people we've met, they don't have the test. They clearly had COVID. Maybe they don't have a regular doctor or nurse. They can't find someone to give them that note. Talk to the team. There's different ways that we can kind of do our detective work just to kind of make it clear that you do have COVID. So there's ways that we can do workarounds. And the team is really good at doing this. And so just talk to them. But we would prefer, but we recognize it's not always available, some type of test and or a care provider saying, yeah, you had the condition. If you don't have either one of those, don't frustrate, just call the team. We got a few workaround strategies that we've developed in those scenarios. There are some criteria that make you not eligible. Let's say you're under 18. By the way, you can be older than 18, 60, 65, 70, 75, but you just can't be under 18. You cannot be actively abusing drugs and alcohol. That's another criteria that come out. But I think for now, what I'll do, I'll just leave it for that. Talk to the team because everyone's got their individual story. And I will never be able to cover all the different kind of scenarios that people find themselves in. If the team could give you a quick answer, just call them up or email them. We can get those answers right away to you. And really, in fact, what I want to emphasize is it's a fairly low intensity involvement. In other words, you don't come into a hospital, you're not staying for 2 weeks or 6 weeks in a hospital. It's done as an outpatient. And what we also try to do, we try to keep the visits brief. Thirdly, what we also try to do is, again, we know people are busy. So to the extent possible, a lot of the questionnaires and so on can be done online. So it really makes it very efficient. Now, the gist of it is, if you meet the criteria and the team will meet with you promptly, usually within one business day, they'll chat with you, set something up, determine your eligibility. If you are eligible, they'll go through an eligibility checklist with you. And when going through that, if you meet the criteria, you'll start right away. And what will happen is that for the most part, you don't need to stop your usual medications. If you're taking medications for medical problems, this and that, we just add it to it. You'll see our team, you'll see one of our family docs who works within the study, and you'll have visits. It's an 8-week study, and there'll be measurement taking throughout that time. And we're particularly interested, obviously, in how well people are thinking or how much they're impaired with brain fog. And then what we're going to do is we're going to look at the change in that outcome across time. Now, this is what we call a placebo-controlled study. Just to clarify, because some people may not know what that actually means. I think that may be familiar to some people, but maybe not others. So what happens is that we're not going to know. It's blinded. We're not going to know. The person's not going to know what they're on, but you're going to get a placebo or you're going to get the medication for 8 weeks. And the reason why I've been asked, well, why do you have that? Why doesn't everyone just get the medication? Well, we won't know if someone getting better is because the condition's just getting better on its own, or is it getting better because of the medication? We're not going to know unless we have a placebo. And so it serves as what we call the control. Where I'm going with this, placebo is not no treatment. The FDA recognizes placebo actually works. That's actually why we have it. We're trying to show the medication can work even better. So in fact, if you come and you're deemed to be eligible, you want to be in the study, you get assigned to placebo, you're not getting nothing. You're going to be seeing our team and whatnot and so on. And quite frankly, I've been doing clinical research for 25 years. Placebo is not just nothing. You're going to be seeing our team, going to be going through a variety of tests and so on. And that in itself might help some of the symptoms. That's why we have placebo in the study, because placebo is not no treatment. Now, our hope is that the medication works even better. That's the whole purpose. But placebo is not no treatment. That's a great question. Look, I think at the end of the day, I want to make the point really clear. This is a study. I take the view strongly that when it comes to treatment for anything in medicine, don't use anything in medicine unless it's been shown to be safe and shown to be effective. So I take the view, and this is my bias because I'm a psychopharmacologist. I work with meds, with medication. I'm a medication researcher. And I take the view that everything should be proven to be safe first. And secondly, does it work? And I wouldn't recommend anything unless it's safe and or works. And frankly, we don't have a treatment yet that the Health Canada or the FDA has approved for long COVID. So we're still stuck in the research of this. So I wouldn't recommend any treatment for long COVID because nothing in fact has been proven or endorsed by the FDA or Health Canada. So for now, we're still in the research arena, and that's where we should remain until we demonstrate the safety, and then does it work? So now, admittedly, a clinical trial is a clinical trial, and you're contributing your time. Hopefully you benefit, obviously, but the information that we're going to gather is obviously going to help the millions of people who are being bothered by this problem. So it's going to be a contribution to, I guess, your peers, your citizens of the country and around the world, and obviously to science. So the study is recruiting so quickly that we really expect by the end of the year, we're going to have this thing just about wrapped up. I think that's probably going to be the case.